oleh pembelajar yang hidup dengan HIV di sub-region ini, sub-wilayah ini. Jadi, dan apa yang perlu kita lakukan untuk mengatasi masalah yang dihadapi oleh murid muda ini, anak muda ini. Terima kasih Sandip, halo semuanya. Untuk pertanyaan Anda, saya rasa stigma dan diskriminasi bagi pelajar yang hidup dengan HIV, jika tidak ada layanan counseling dalam lingkungan edukasi untuk ODA,
when there is a lack of education and awareness, and the education may include CSE, when there is a lack of education and awareness done to individuals within an organization, such as students in the learning institution, and with the lack of awareness, that is what greatly contributes to stigma and discrimination, especially for students living with HIV.
Thank you, Cameron. So indeed, the lack of awareness is one of the main drivers of stigma and discrimination in the education setting. Perhaps I ask another question then to our colleague, Mr. Anand Singh. Education International has a unique perspective in advocating on the working conditions of educators. In your view, what are some of the situations that educators face in dealing with issues relating to HIV, stigma, discrimination? And I think if you could share what is the educators' experience, that would be great.
Thank you, Sandeep. Thank you. And to UNAIDS and UNESCO, great appreciation for organizing this consultation meeting, which was important and on a very important issue. We are a teachers union representing around 8 million educators in the Asia Pacific region. So my experiences, or what I'm going to say, is basically coming out from our work with those teachers across Asia Pacific. So in terms of, I'll start with some negatives and then maybe some positives also. What we have seen in across Asia Pacific is that most of teachers continue to find themselves inadequately trained on issues around HIV and other stigma, related stigma and discrimination. That was also very clearly coming out from Mr. General's presentation. They need and they demand more training, and teachers training in many countries do not build capacities of teachers around these issues. That is number one. Number two, over the years, schools and teachers have been threatened, intimidated, and harassed for teaching non-discrimination, especially in the communities where stigma exists. They have also been at the receiving end of this, and this is true that with HIV, AIDS as well, safer school for students and education personnel is important. And I think we all need to work together towards making sure that our schools are safe, they are free from discrimination of any kind. Teachers, and something about teachers with AIDS, and especially women, they complain about continued discrimination on career development, training opportunities, and access to medication, and so on and so forth. So these are some of the negative that we noticed. When we look at the positives, and these experiences are coming from some of the work that we did with our affiliates in some countries, particularly in few states of India, where in many communities we found that teachers affected by HIV, AIDS have been among the leading advocates against stigma and discrimination. Some has risen to prominence, and there are potentials on teaching communities which should not be undermined. The schools and teachers are such situated that they can expand actions against these issues beyond prevention and care. They can help in building sensitization, building awareness, and so on and so forth. They can also be instrumental in changing the minds. Over the years, schools and teachers unions have been successful in highlighting the gender dimension of existing discriminations and or the rise of pandemics like within the pandemics and also HIV and so on. And in fact, we have, like as I said, we have been working with the affiliates. And one thing that we noticed is that when we are in a small area, the communities are generally, they don't know. I guess I'm running out of time. So they don't know much about HIV or how. So there are a lot of misconceptions. So our teachers, they went on to the ground and they raised awareness among themselves and also their communities. So it helped raising awareness. So what we believe is that education and health are mutually complementary. And reinforcing the school is a place for the improvement of both health and education. The comprehensive school health programs, including instruction, health services, and school environment, can support healthy behaviors for children, adolescents, and school personnel. So, thank you. I'll stop here.
Thank you, Anand, for that remarks. I think it's interesting that even teachers who try to address the problem face a lot of harassment and discrimination. So that's a very interesting point to bring out. I move over to Hari. Hari, as you know, APN works closely with people living with HIV of all ages. What are some of the manifestations of stigma and discrimination facing young people, specifically in relation to education? Could you share some of the experiences you've had in working with young people? What are some of their concerns?
Thank you, Sandeep. Yes, so basically, but the manifestation of stigma discrimination in educational setting has been reiterated by Tawfiq and also the young fabulous speaker that do it in their opening remark. But basically, it's almost the same. They're facing bullying and violence, neglect awareness and isolation, breaches of confidentiality, denial of enrollment, or they're sometimes implicated to the health itself, including the continuum of care if they have HIV, and also affecting their mental health. But to understand the factors that influence stigma discrimination, we have to understand the ranging of the factors that stigma discrimination may occur, which is coming from the school policy or teachers' attitude to the comprehensive of the sexual education curriculum, which is Janelle's or the tackle in her presentation. But one thing that I'm really worried about is about the adolescents and young and adolescents. Since adolescents basically they are in the transitional period where they are start to exploring their sexuality. And they also not yet equipped with knowledge on social skills to respond to stigma discrimination. Thus, at the same time, this adolescent needs support to navigate safe and consensual sex. With young adolescents, they are most struggling with the intersecting and compounding vulnerability related to HIV status, socioeconomic, gender and sexuality, and export to violence in their home community and school. That's from the student perspective. But if you're looking for the educator perspective, there will be intersectional between the education setting and the workplace settings, where the educator mostly in both settings. So that's why this if you not really address this, especially in the HIV response, it will implicate on the adherence, basically, for sure, and then the further suppression that we will all would like to say, because now we understand that U equals U is really work, and then part of that there was also global initiative on stigma discrimination called the Global Partnership to Eliminate HIV-related Stigma and Discrimination, where global partnership is working in the 6 settings. Which is individual, family, community settings, healthcare settings, workplace settings, justice settings, education settings, and emergency response settings. Which we think that these settings, it will help to provide support on the HIV response. That's all from myself, Sandeep.
Yeah, thank you. I see Cameron has raised his hand, so without asking further question, Cameron, go ahead and share further. Yeah, thank you.
Thank you, Sandeep. So similarly to what Harry has said, from a learner's perspective, something that I can relate to, like just by seeing within like this space, is students who are unaware of safe sexual and reproductive habits have a higher risk of infecting themselves and others with HIV and other STDs, especially when they associate themselves with, by doing unsafe sexual behaviors. And And this is very prevalent, especially in rural settings or settings where that aren't urban based, because like especially for my country, Papua New Guinea, we can have the access, like services can go out to these rural settings, but then if there is not, if there's no education, and like if they do not know how to use or access these services, I find that that is
Cameron? I think you're breaking up. Is it me?
Cameron, maybe perhaps you just switch off your camera and then you will get better.
Yeah. I think he can't listen here.
It's a matter of bandwidth.
Yeah, I think so. Hi, Cameron. Let me just tip it. Oh,
Okay.
he left.
No problem.
Yeah. So let me just quickly remark on Cameron. So Cameron did say the importance of education, but I wanted to ask both Anand and Hari, and if Cameron is possible, we see the terrible manifestations of stigma and discrimination as violence, as bullying, as intimidation to both teachers and educators. The question I have is, when we really know that stigma and discrimination not only affects health outcomes, as Hari mentioned, but also affects education outcomes, dropout in schools and worsening school and performance and things like that. I would like to ask both Anand and Hari and Cameron, if he's managed to come in, what do you think should be done to address some of these terrible situations and very unsafe learning environments? Maybe Anand first, and then Hari.
Thank you. Yes, that's a very important question. And what we as education unions feel that though there is, of course, a decline in the number of discriminatory acts and against the learners, against the teachers in the past few years, but there still remains a significant gap. Progress in terms of education, in terms of sensitization, in terms of awareness, and when I talk about teachers, access to treatment, care, and support has not increased as much as it should. Millions of teachers remain without healthcare, medical insurance, or necessary information. We feel that teachers are best suited to address issues of status, prevention, treatment of their communities. Teachers should receive pre-service and in-service training on HIV and AIDS and overall aspects of comprehensive sexual health programs. The government and non-governmental support to teachers and their organization to address these issues is important and should be increased. We also need to actively promote a comprehensive school health program policies that include prevention of HIV, AIDS, notably by implementing comprehensive sexuality education programs, which should be one of the key considerations, also talked about by Janelle. And then other key considerations should be that ending all forms of discrimination and exclusion at school and at workplace, especially in pre-employment detection tests, marginalization of the groups which are considered at risk, and unfair dismissal. We also need to be careful about that. We as teachers unions have been playing active role in developing health education policies that involve many ministries and across many countries. And it is important that these ministries, Ministers of Health, Social Welfare, Women Development, Education, they coordinate with Ministry of Education, because that coordination has been lacking. All these ministries has been working on their own. And what also we feel is important, that the partnership with the teachers unions and civil society in developing these policies and implementing those policies. This is a joint mission, and that we have to work together on these. Otherwise, we will not reach anywhere.
Go ahead, Hari. Then Cameron.
Okay, so I think, remember the global initiative that I just mentioned, global partnership to eliminate HIV-related stigma and discrimination. What a long name. But the key is from that is partnership. I think the partnership that what we are talking about, we need. I mean, Taufik already mentioned it earlier, and in one during his opening remark, that partnership is really, really important. Partnerships between student and the teachers, anything but partnership, because working on stigma discrimination, we're not going to able to achieve what we really want if we not try to establish a partnership. Second is about leadership. I think leadership is very important. Leadership from the educators, leadership from the student self. So everyone has roles in terms of working on stigma discrimination. That's from my part, Sandeep. Back to you.
Thank you, Harry, for pointing out the importance of partnership. Maybe Cameron, if you are here, my question to you, Cameron, is just to repeat if you didn't hear, is you mentioned that stigma and discrimination do manifest in the education setting and affects learners. What can be done to address some of these challenges that learners face?
Sure thing. So for me, I think like from a learner's perspective, I think that educational institutions and those operating in the educational sector, they need to ensure that awareness on accessing SRHR services and CSE services is being done at all levels, like in urban areas and also in rural areas. And educational institutions and those operating in the educational institutions, they need to ensure that support groups and services and counseling groups, especially for people living with HIV, are easily approachable and accessible within the educational institutions at all levels, within urban and rural settings, especially for rural settings, because as a youth advocate, I've been to rural areas where there is the service there for accessing like sexual and reproductive health. There are services, but then the rural communities do not want to access them, or they do not want to approach them because there is not much, there's not much education being done, awareness on how to approach the services. So that is one issue that I find, especially with the rural setting. So yes, and one more thing is for the students themselves or for the learners themselves, if like partner organizations can come up with behavioral change campaigns and programs, so that the students can join these campaigns and programs, and it'll also build their capacities, and so they know when they are causing stigma and discrimination and when they aren't. So that's all from me. Back to you, Sandeep. Thank you.
Thank you. We still have a bit of time, so I want to ask you another question. I saw the staggering numbers from what Janelle presented. Like what to me was haunting in countries like Indonesia and Malaysia, 30% of communities think that students with HIV shouldn't go to school. That's extremely haunting and staggering to me. But we also saw from Janelle's presentation that there's not much awareness of stigma and discrimination in school, not much data, not much evidence on what stigma and discrimination and how it manifests in schools. From especially highlighting both the teachers and learners' perspective, who are in the forefront. So perhaps if you could share with us, Anand, Hari, and Cameron, how can we move ahead with generating getting some light into this problem? Because the number indicates that it's quite staggering, and it's quite haunting to me to see that communities believe and said that 30% shouldn't go to school. That's absolutely very, very terrible. So Anand and Hari, could you and Cameron as well, could you share what you think should be done to highlight this issue? Because I think there's not much evidence, especially from the teachers and Cameron as well. Cameron has raised his hand, so perhaps we should start with Cameron. Go ahead.
Sure thing. Thank you, Sandeep. So I think one way on addressing stigma and discrimination in the educational setting especially is if we have behavioral change campaigns, because I feel that when we have the behavioral change campaign, that will change the learner's behavior, and that will hopefully shed some light on the issue. And I feel that having the behavioral change campaign will help a lot, especially with decreasing the stigma and discrimination for people living with HIV, and also for those who have have other sexually transmitted diseases that have acquired that. So yeah, that's all from me. I feel that it's having a behavioral change campaign is very important. And in my country, I've seen that UN Women, they also have what they call the Sun Up One Time campaign, which is a behavioral change campaign. And they go from urban settings to rural settings. And that has created, it's gained a lot of momentum and it's impacted a lot of lives. So yeah, that's all from me. I feel that behavioral change campaign is probably the best way to start off with. Thank you. Back to you, Sandeep.
Thank you, Cameron. Maybe Anand and then Hari can can give a overview.
Yes, I think the number that Jamil presented may not be correct. The number could be actually much more higher than what we know. And this is based on I'll give you an example from India, where we have been working in two very small districts and in the rural areas of ASEAN. The state there, and there, the population is predominantly not very aware of things. They are not all of literacy rates are too low. Their awareness level is too low. So they had sort of too many stigma, misconception about a lot of things, and that generated their stigmas and discrimination against people infected with HIV and AIDS and so on and so forth. So what helped there to build awareness, to build change in their mindset was when teachers' unions, school management communities, and some of the parent organizations, we started working together. We did an awareness campaign. We developed some small campaign tools that we disseminated across the community, and we had sensitization meetings with the community, and that's how we could change some perspective. It was not 100% what we expected, but at least there was some change. So it is important to raise awareness around the school communities, not just within the school communities, but also where we work. And they need to inform, they need to be made partners, they need to know the realities. So I think that's one thing that we need to do. And there have been national programs and so on and so forth, but those programs have not given us all the desired results that we expected, like NACO and so on and so forth.
Thank you, Anand. Hari, go ahead.
Okay, thanks, Sandeep. So I'm agree on awareness, 100% agree. We need awareness about HIV. But again, 10 years back, when I'm still back living in Malaysia and work in the national network there, I have a feedback on the HIV response awareness that mainly, even from mom waiting their son at the school, they said they still believe that mosquito can transmit HIV. That's 10 years back. So there's another question about awareness. We have to do business, not that like usual that we always do. So I think what I do best, I try to see on the healthcare settings, why healthcare settings we become the fear of being stigmatized and discriminated in the healthcare setting are less than in the education setting. I think because I'm still talking about Indonesia. I think because we managed to incorporate the curriculum to understand key population and PLHIV in the medical institute. So this is part of the credit that they have to earn before they graduate. So this is another thing that we have to think. Especially now we have comprehensive sexual education. Maybe we try to push government to put this education, this part of this comprehensive sexual education, including understanding PLHIV and key population, to be part of the curriculum for these educators before they graduate to become educators. Thanks.
Thank you. We have about 10 minutes left, but I wanted to ask if we have a question here to colleagues from Niwat. That says, do we have examples of safe mechanisms of reporting and solving stigma and discrimination in education setting? I think that's the panel. The second panel would explore that more. But if colleagues here, do you have any answers to that question? Please go ahead and respond to it. And participants, if you have questions, you could raise your hands or write it in the chat. Maybe Anand, maybe you could try to answer that question.
I'm not aware of any concrete mechanism. That was one of our demands as well. But I think there could be country-specific practices and processes which other colleagues may be able to speak more.
Go ahead, Cameron.
Thank you, Sandeep. So for the first question, from a learner's perspective, I think the only mechanism in place is the ones that are done by the education institutions themselves, where wherever there is stigma and discrimination, you report it to your teachers. But personally, I do not think that is effective. But answering the question, apart from that, I don't think that there's any mechanisms in place.
Yeah, and that's a very, very interesting question. And stigma and discrimination can manifest as gender-based violence or violence towards children, and there should be reporting mechanisms in place integrated into those existing systems. But there's an interesting comment here from Norman. Norman, do you want to share? Do you want to speak out and share your experience, or do you want me to read? So Norman says that speaking from Malaysia, folks who are already working in the HIV field, we know which tools to employ to reduce stigma and discrimination across all levels. But the challenges that they face is policies preventing disseminations of such information to below 18. The harsh, perhaps backlash or even resistance towards dissemination of information. Then second, there are so many pressing pressures in the education, especially on how to catch up from loss due to the pandemic. So it's unfortunately not prioritized. The education system is moving towards reducing the number of things or number of the curriculum, making it more adaptive. And those are the challenges they face. So, maybe our panelists here, if you have any response, but we have Alex as well, who raised his hand. So perhaps Alex, you go ahead and share your question, and then we can ask the panelists to respond.
Hello, actually I am one of the panelists for the second discussion, but just to hop into the discussion and answer the first question being raised with, in the mechanism or reporting. Actually, it really depends on the policy we're in. Like, for example, in the Philippines, we have a policy, a state policy, wherein you need to report directly to the guidance office or report it to the authorities immediately if you feel discriminated and stigmatized because of your status, whether you are positive or not, because that is one thing for us to reduce inequalities in schools and even other institutions. And it really depends on where state you're in, and it depends on the policies that was institutionalized in the school setting.
Thank you, Alex, for those comments. Indeed, we have just a few minutes left. So, Hari or Anand, if you can.
Yes. I just want to address about the policy. I think yes, in the HIV response, consent is good. I mean, we need consents. In order for us to get approval from what they want to do to us. But I think if you can again, establish partnership. This is what you need. You need to establish partnership with your local government. That you aim the purpose of your work, which is preventing and then try to preventing stigma discrimination at the healthcare settings. I'm sure if the partnership is established, the issue on consent will be raised. I mean, you can address that consent. That's my take. Because right now there is a little bit strong push try to integrate mental health and SRH. So I think there's not, again, for the lessons where the burden is the age, because we need a consent before we enter to provide prevention to them. I think, my take point is like partnership. That's what we need to establish.
Thank you. We have another question. So let me just, we have also only 2 minutes left. So let me just, maybe that's a comment. So let's go ahead. Lone, could you just share briefly what your comments are? Oh, was that a raised hand? It was not. Then Anand, go ahead. And if you have any responses to that tough question from Malaysia.
No, yes, no, I don't have actually any response to that. But as Harry said, partnerships are important. But what I also want to add here is involvement and engagement with stakeholders, with partners, with the communities. We cannot have top-down policies decided at the top and then sent to the grassroots for implementation. So we need to have these discussions at all levels, all the stakeholders, teachers, communities, and so on. So that is the way where we'll get more engagement and acceptance. Also, the issue of consent could be considered there. Yeah.
Yeah. So I guess we are out of time, colleagues. Before we move on to the second session, let me just wrap up and say that indeed, stigma and discrimination does manifest in the education setting, although there's not much data on it, and it affects both health outcomes, it affects education outcomes, and one key solution that our panelist has identified is awareness raising and comprehensive sexuality education. And in that sense, we need partnerships and involvement from actors. Without that, then top-down policies would not work. So thank you, colleagues. We have a quick photo session at the moment. If you can on your cameras, maybe I hand over back to Quinton for the photo session, and then we can move on to the second. Thank you so much, colleagues, for this interesting discussion.
Thank you, Sandeep. You said it all. Before we go into the health break, we would like to just take a quick photo of all of you. Colleague S is going to help us with that. And to have a photo, you need faces. So it's all nice to see the faces of people popping up while everybody's putting the hair in order and make sure that they all look good. You all look good, no worries for that. I would like to invite S to take a quick photo, and maybe S can count so that we know also when we have to smile.
As we have so many people here, let me take a picture one by one. Please smile for me. One, two, three. One, two, three. Okay, finish. Thank you very much.
Thank you, and thank you, colleagues. It's 10:12, so I suggest we take a quick health break and we reconvene at 10:20 or 20 minutes past the hour for people that are not in this time zone. So 20 minutes past the hour, we will continue with a session on strategies and entry points on stigma and discrimination in healthcare settings with another panel discussion that might also answer the question about concrete mechanisms that are in place. So we reconvene at 20 minutes past the hour. See you in a bit. Thank you. If there's any questions, you might want to type them in the chat, and also Billy shared again the link to the community of practice where we can continue this discussion and where we can exchange ideas and thoughts about stigma and discrimination in healthcare settings and how to address them. So if you have not registered yet, you might want to do that now. Thank you, and speak later.
Recording stopped.
Oke, itu adalah sesi stigma dan diskriminasi dari atau yang diselenggarakan oleh USAID.